Phacoemulsification is a surgical procedure commonly performed in ophthalmology to remove cataracts and restore vision. During the procedure, the surgeon makes a small incision in the eye and inserts a tiny probe that emits ultrasound waves. These waves break up the cloudy lens of the cataract into small fragments, which are then suctioned out of the eye. Phacoemulsification is preferred over traditional cataract surgery because it requires a smaller incision and allows for quicker recovery. Patients typically experience less discomfort and have a faster return of vision. After the cloudy lens is removed, an artificial intraocular lens, IOL, is usually implanted to replace it. This artificial lens helps to restore clear vision and may reduce the need for glasses or contact lenses. Phacoemulsification is considered a safe and effective procedure for treating cataracts, with a high success rate in improving vision and quality of life for patients. However, as with any surgery, there are potential risks and complications, so it's important for patients to discuss the procedure thoroughly with their ophthalmologist before undergoing surgery.